want to say thank you to everyone here for giving me the opportunity to tell you about this study, and to NIOSH for the support in conducting the study. So I'm Lucia Ferri. I'm Assistant Mental Health Director of the World Trade Center Clinic here at Bellevue Hospital. And I'm also a psychologist there, so I see patients for mental health treatment in the clinic. So our World Trade Center Environmental Health Center serves a survivor population, which is basically anyone who was not a first responder that was present on the day or in the months afterwards and had some kind of mental or physical health condition. They come to our program for screening and treatment. And to say a little bit more about our population, a large percentage of our survivors screen positive for mental health symptoms like PTSD, anxiety, depression, and a number of other conditions. We find that these symptoms have persisted over the years, and they're also comorbid, as a lot of my colleagues have mentioned, with other medical conditions, including respiratory illnesses, gastrointestinal illnesses, cancers, and other conditions. So in our population, about 33% of our survivor population in our program identifies as Hispanic. We found that the Hispanic patients report higher rates of PTSD, anxiety, and depression, that they report that these symptoms persist over the years, and they also have very high rates of respiratory illness and other medical health conditions. Research has shown, and a lot of the research you've heard earlier today speaks to the effects of PTSD, mental health, and their relationship with physical health symptoms as well. So what we know is prolonged PTSD really results in a chronic stress response that can affect physical functioning as well, and physical health as well. There is little research on clinical treatments for Spanish-speaking individuals with mental health needs like the ones we see in our population. And due to the presence of both PTSD, anxiety, depression, and other mental health symptoms, along with the medical symptoms, we really strive to find treatments that can address both the mental health and the physical symptoms that our patients are dealing with over the years. So in this study, we sought to assess the feasibility and acceptability of this mind-body treatment that has been used at Stony Brook with the responder population to good effect, to really treat our Spanish-speaking World Trade Center survivors with chronic and persistent PTSD symptoms. It's the Relaxation Response Resiliency, or 3RP treatment program. It's a mind-body focused group psychotherapy treatment that has been shown to good effect at Stony Brook. It teaches patients to elicit the body's natural relaxation response. This relaxation response has proven to have positive effects on many mental and physical health problems, including PTSD and respiratory symptoms in the research. So we first translated the manual into Spanish along with all the worksheets and adapted it for use with our Spanish-speaking population. We then recruited 20 Spanish-speaking World Trade Center survivors with persistent PTSD symptoms who were interested in participating in the group psychotherapy. Participants were divided into 4 groups of 4 to 6 members each, and they met for 8 weekly sessions of group psychotherapy that lasted an hour and a half each. Groups were led by a Spanish-speaking PhD level psychologist. At the first group psychotherapy, participants were provided with binders that included the patient manual, worksheets, and weekly homework assignments that they utilized at each group session to read along with the group content and complete in-session worksheets and exercises, and then they had exercises that they had to do during the week at home and then report back. Participants completed measures of PTSD, anxiety, depression, medical symptoms, life functioning, health-promoting behaviors, and mindfulness at 3 time points. It was a lot of questions. They first answered these questionnaires at baseline, which is before they started the groups. Then at, oh, am I done already? No, okay, no, sorry. Then at, okay. Okay. Then at exit, upon completing the 8 group psychotherapy sessions, and at 1-month follow-up. So let me tell you about the group quickly. We had a diverse group of participants from the Dominican Republic, Puerto Rico, Guatemala, Ecuador, Colombia, Mexico, Honduras, Bolivia. It's representative of our population. They come from all over. They all identified as Hispanic. The average age of our group members was 55 years old, and we did have 50% male and 50% female. They were exposed to the disaster as local workers, cleanup workers, and residents. 75% or 15 of our participants completed all the group psychotherapy. And what we found is a decrease in symptoms of PTSD, medical symptoms, anxiety symptoms, perceived stress, and depression between baseline and exit. Although this was not statistically significant, we did see a decrease in the scores. We also saw an increase in life satisfaction, which was observed between baseline and exit and as well as 1 month follow-up. What we did find statistically significant was a change in a measure of general health-promoting behaviors. Participants reported an increase in physical activity and a significant improvement in stress management through the course of the group and by the end. In open-ended interviews, they were asked about changes in their symptoms and health, perceptions of the group, and overall experience. And all the participants reported that they benefited from this treatment program and they really liked it. All of them mentioned they really like learning the different breathing relaxation exercises. They also reported making positive changes to their diet and exercise routines as they learned in this program. They didn't love the homework, but I don't know who does. Many people did it and many didn't. Okay. So overall, this study provides preliminary evidence for supporting the clinical effects of this group psychotherapy treatment. And before I end, I want to tell you a little bit about what we did in the treatment and how we and what we thought it taught and was effective. So it's really a treatment about resilience, a word that you've heard here from other speakers. And it's characterized by several factors that are actually themes and topics that we discussed in the group psychotherapy sessions. So group members learned about, 1, awareness of the stress response, which is like a flight, fright, or freeze response in the body, and how it affects the body and its functioning. They also learned about the ability to bring about the relaxation response through a number of breathing relaxation exercises, other meditative techniques. We even did yoga, chair yoga. The ability to recognize negative thoughts, the ability to create adaptive thoughts and positive expectations, also developing a more optimistic and positive perspective by appreciating positive experiences on a daily basis that we actually reviewed in the groups. Increasing a sense of connectedness through social support, empathy, and pro-social behaviors like acts of helping others or volunteering or sharing, and also changing to healthful sleep, eating, and exercise habits. So overall, this treatment protocol had a positive effect on the participants. It was really well liked. As it has shown efficacy, I look forward to continuing to use this protocol as one of our treatments offered and to really further investigate the benefits of this treatment in larger populations over time. Okay, I did it. Thanks.